Hi, my name is Monica, and the article I chose is about a new Alzheimer's treatment called lecanemab. The FDA recently granted full approval of this new Alzheimer's immunotherapy treatment that has been shown to moderately slow cognitive and functional decline in early stage cases of the disease. Alzheimer's disease is an aggressive disorder that damages and destroys nerve cells in the brain, and over time, the disease leads to a gradual loss of cognitive functions, including the ability to remember, reason, use language, and recognize familiar places, and it could also cause a range of behavioral changes. The drug is delivered by an intravenous infusion every 2 weeks, and it works by removing a sticky protein from the brain that is believed to cause Alzheimer's disease to advance. This happens to be the first treatment in our history that shows an unequivocal slowing of the decline in Alzheimer's disease, and this is the first time in 2 decades that the FDA has granted full approval to a drug for Alzheimer's. During trials, there were 1,795 participants with early-stage symptomatic Alzheimer's disease, and lecanemab slowed decline by 27% after 18 months of treatment compared to those who received a placebo. This treatment selectively targets the forms of amyloid protein that are thought to be the most toxic to the brain cells. The data is encouraging that the longer the treatment, the better the effect, but they would need more studies to determine if that's true. This article is important because it's the first time that a medication has been introduced and gained approval that can slow down and potentially treat early onset of Alzheimer's. It can be such an aggressive disease and can start to affect adults early on in their life. If this treatment can truly help individuals in the early stages of Alzheimer's, it can save patients and family members a lot of pain and suffering. It is not a disease that just affects the patient, it affects everyone around them. The cost for this treatment as of last year is $26,000 per year. Medicare said it will cover 80% of the cost, but as of now, it's expensive, making it difficult to afford and obtain. If Medicare does cover that much of the cost, then there might be better access and coverage for it. Right now, there's no commercial insurance coverage for it, making it hard to access and afford. Hopefully, commercial insurance will follow in the same coverage. The concerns I have for this treatment are that there are side effects, some mild and some a bit more extreme. Those side effects are related to the infusion, such as flushing, fever, chills, and rash and body aches, which could be managed. The more extreme side effects are the possibility of edema or fluid formation in the brain, or possibility of a minor brain bleed, which could be very dangerous. That being said, we do have to ask ourselves, does the reward outweigh the risk? The only question left unanswered for me is, how do they know when the right time to start this medication before it progresses too far for it to work? They mention in the article about doing earlier intervention on individuals who are still cognitively normal, but they don't mention how early they can start and up until how late. Overall, I think that this is a very promising treatment path that we haven't seen before to treat early onset Alzheimer's. The path of immunotherapy is showing how modern technology can improve and hopefully limit the amount of people who have advanced into full onset Alzheimer's. It is such a tough and scary disease, not only for the patient, but for their family and loved ones as well. If this medication can safely treat Alzheimer's before it even progresses, it will be a huge win for medicine. Thank you.